Hi, my name is Samson Samuel, and this video highlights the importance of developing and implementing some mitigation activities to reduce the incidence and also the effects of post-traumatic disorders in individuals who are exposed to either man-made or natural disasters. The development of psychopathology of post-traumatic disorder depends on multiple factors. It depends on the degree of the injury the person is exposed to, the amount of life threat, the duration duration of the exposure, and also the individual's biopsychosocial vulnerabilities, and also the coping abilities of the person. Now, psychiatric intervention after disaster draws on the principles of psychiatry, public health, and behavioral science and medicine. Now, there is a general tendency in any kind of disaster, the primary factors that's been implemented are to the exposed or the people who are exposed to disasters are given providing shelter, sanitation, and food, clothing, and shelter. Those are the primary aspects that's been given to these people who are afflicted with these disasters. Now, the psychiatric needs of the person takes a back burner, or in fact takes a secondary importance. It is very important to understand the psychobiology of post-traumatic disorder, which can have a devastating effect on an individual and can have long-term implications on the person's life. The post-traumatic disorders can be mitigated by early screening, identification of risk factors, coping abilities of the individuals, and also preparedness and training of these individuals, and leadership and support, team building capacities that will train these individuals who are exposed to disasters to decrease the effect of the psychological toxins that affects the minds of these people who are exposed to the disasters. This post-traumatic stress disorder is the most common studied psychological disorder and occurs in traumatic events and disasters. It is found to be higher in disasters that are man-made or technological disasters versus natural disasters, and people who are prior history of psychological problems, people who are anxious and nervous individuals are more affected by post-traumatic stress disorder when they are exposed to disasters. The prevalence of this post-traumatic stress disorder is directly related to the person who is affected by this. The person who was exposed to this disorder is more affected than the rescue workers or in the general population. The incidence of post-traumatic disorder is high in individuals who are exposed to these disasters. Female gender are consistently been shown in multiple studies have a risk factor for the onset of post-traumatic stress disorder. Psychological factors such as guilt, anger, external uh, uh, weaker coping abilities of an individual have been associated with post-traumatic stress disorder. So this is basically an anxiety disorder. Creates a lot of problems in individuals, such as feeling stressed, feeling anxious, frightened, with nightmares, and can have long-lasting effects on the life of an individual. So this video highlights the importance of finding ways to get immediate treatment for these individuals who are exposed to disasters by developing some mitigating preparedness by healthcare organizations or other organizations in order to prevent or decrease the level of effects of post-traumatic disorder on these individuals. Uh, this mitigating activities in healthcare organizations should consist of adequate psychiatric services, uh, uh, about serious availability of ample mental health resources, mental health workers, and availability of counselors, psychologists, psychotherapists who can assist in removing these barriers to treatment. Early detection and early treatment will decrease the effects of these psychological toxins that are that are affecting these individuals. So psychiatrists and mental health care workers, proximity to the disaster will bring about a crucial and a rapid response, uh, and uh, and these individuals will be available immediately after the person is exposed to a disaster by counseling these individuals, and also counseling the individuals and bringing about uh, help to these individuals will help to alleviate some of this long detrimental effects of post-traumatic stress disorder in individuals who are exposed to whether man-made or natural disasters. So early intervention to reduce grief symptoms with support groups should bring about efficacy equal to that of active psychotherapy, has beneficial effects in mitigating the psychological effects of a disaster. An early institution of behavioral pharmacological therapy, and and also bringing availability of ample mental health care workers and counselors, psychiatrists, psychotherapists at the scene of disaster will be helpful to individuals to decrease and reduce the post-traumatic stress disorder, and also decrease the long-lasting effects on these individuals. Uh, so this video highlights the importance of post-traumatic stress disorder, which usually takes a secondary role in most of the preparedness and readiness aspects of disaster, and taking adequate preparedness and mitigating activities by healthcare organizations or other organizations, and putting this psychological effects as also one of the primary uh, mitigating factors will help in reducing the incidence of post-traumatic stress disorder, and also decreases the symptoms and severity of the problem in individuals. Thank you.